So, good morning. I'm happy to be here in Pavia at the Mondino Foundation. We are here today for a very special occasion because BRAINTEASER has organized a workshop and a roundtable discussion on the themes of AI and environmental impact on the health and related to neurological diseases within the framework of the Brain Week 2025 edition. I'm here with Professor Bergamaschi, Director of the MS Centre at the Mondino Foundation, and Dr. Tavazzi, who has been at the forefront for the implementation of the BRAINTEASER solution and methodologies here in Pavia. Professor, tell us a little bit more about Mondino and the MS Centre.
Yeah, just a few words about the history of this institute. It was founded more than 1 century ago, in 1917, and the first director was Casimiro Mondino, who was the pupil of the Nobel Prize Camillo Golgi, that who is universally recognized as one of the father of the modern neurosciences. And in 1973, this institute was officially recognized as a research institute. So it was the first institute in Italy devoted to research in neurosciences. From then all, of course, we followed every chapter of neurology, both the research and assistance of adult patients with every kind of neurological diseases, of course, multiple sclerosis, amyotrophic lateral sclerosis, and other diseases, dementia, headache, stroke, Parkinson's disease, and so on. And in addition, we follow not only adults, but also children with neurological diseases and psychiatric diseases. Being Mondino Foundation, not only a research institute, but also an hospital, our mission is the so-called translational research. Yes. That is, we perform studies, preclinical studies, and apply them to the assistance of our patients. So it's the so-called from the bench to bedside. Among our centers, one of the most important, one historical center is the Multiple Sclerosis Center. We follow more than 1,500 patients with multiple sclerosis, mainly with multiple sclerosis, but also with other neuroinflammatory diseases. And our field, the main field of interest, are the epidemiology, the clinical course, the diagnosis, because we offer every kind of diagnostic tool to our patients, and the treatment, of course. We have every kind of therapy able to prevent the evolution of the disease, and we offer also novel therapies, because we are a part of a great number of clinical trials focused on new treatments. In the last years, we focused our researches on the environmental factors, and particularly on air pollution, because these environmental factors are very interesting in our field, in the field of multiple sclerosis and of other neurological diseases, because they can be both risk factors for having the disease, but also for having an unfavorable evolution of the disease, neurolapses, disability progression, neurological disability progression. For this reason, we are the leader of a work package 8 of BRAINTEASER project that is focused on the collection, the analysis, and the modeling of environmental factors. So we strictly collaborated with our bioengineers, the bioengineers of our university. But Dr. Eleonora Tavazzi has strongly contributed.
Yes, you have been at the forefront for the implementation of methods and technologies provided by BRAINTEASER within the MS unit here.
Yeah.
Maybe you can tell us something about, for example, numerosity of patients that have been involved, and if you can, some characteristics or main characteristics of these patients.
Yeah. We have a big MS center. We follow around 1,000 patients, a bit more. Of that, the objective at the beginning of the protocol was to recruit 70 patients, and we were actually able to get to that number. We had a couple of dropouts. These patients found it a bit difficult to accomplish what was requested, even if it was a very user-friendly and easy to follow clinical trial, so the protocol. So the adherence rate was very high. Patients are young because MS, with respect to ALS, is a disease that affects mostly young adults. The peak incidence is around 20, 30 years old. So we had this advantage that patients, thanks to their age, were used to technological devices, and so it was kind of easy to implement a couple of devices such as the smartwatch and the portable environmental sensor in their daily life.
So perception from patients has been quite good in relation to this trial. What about the clinical team?
Definitely, we were all pretty happy. One of the main goals of BRAINTEASER was to try to optimize the relationship and the communication between patients and healthcare professionals through the use of this app and dashboard. So the communication was more direct, and that was perceived positively, definitely by the patients. They felt more taken care of, but also from our point of view, because it allowed us to be more prompt in the intervention in case there were problems, and that gave us also the confidence that we were following the patients more continuously throughout their daily life.
Okay, so it worked. I mean, at least
it worked. Yes.
And the communication flow has been easier than usual, than normal practice.
It was, yeah. And one of the other positive aspects of BRAINTEASER, I think it was the tight collaboration and interconnection between different groups of workers on the BRAINTEASER side, so the teams. So it was very good also for us when patients were experiencing problems with the app or the smartwatches, for example. We always had the possibility to confront between each other. So it was a very good experience from many points of view.
Maybe you can share with us some main takeaways. So what did work well, but I think you said it most, and what can be enhanced maybe for the future?
On a practical level, I think it was very good, and it was like also a learning lesson from us. At the beginning, we were a bit scared that the more direct communication was gonna possibly lead to higher burden for us, whereas for a patient to feel more taken care of means also that he's more relaxed. And so the main takeaway from a clinical practice point of view is that it's very good if these kind of tools get implemented in the clinical practice. And from a research point of view, we also learned, we had a hint of it before, of the importance of taking into account also lifestyle-related factors when we talk with patients.
Okay. We all know that BRAINTEASER is about to an end.
Yeah.
So the project will finish by the end of June.
Mm-hmm.
Do you think there will be a future for these solutions? I mean, there will be a continuity in usage, even though the funding period, let's say, from the European Commission will be over. So,
as I've said, the mission of our institute is the translational research, and I think that this project is really a perfect example of translational research, because I fully convinced that the results of this project could be easily applied to our daily activity and practice. And at the end of the process, I'm sure that this approach could favor not only the patients and the quality of life of the patients and our capacity to assist these patients, but also the quality of life of the caregivers and even of the medical doctors that follow the patients and the researchers.
And on this note, I would like to thank you so much, first of all, for all the work refused and done within the project, and for sharing with me these insights and your time. So see you soon for the next one.